Hello, sir.
Hi.
So many patients they are asking queries regarding nasal irrigation. Can you please guide us on the nasal wash?
Yeah, sure. It's a very interesting topic and also very easy methodology to take care of our nose and sinus health. Coming to the nasal wash, it's not a very new technique. It's a very age-old technique which has been followed in our India. According to the yogic science, it is called as Jala Neti, where we irrigate our nose and sinuses to drain or to clear the secretions. Especially it is helpful who are having this chronic sinus issue or also the allergic sinus issue. So now coming to the technique of direction of using this bottle. If you are using to the left nostril, direct the tip of the bottle towards your left side. Vice versa to the right side. So angulate the tip of this bottle towards the right side if you are using on the right nose. Once you insert it till wherever this applicator snugly fits and bend your head a little bit towards the wash basin and give a gentle pressure on the bottle like this. So the irrigated fluid which travels up to the tip and irrigates to the nose and sinus. While irrigating, what you can do, the other technique is just make sound ka 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 ka. While making this sound, the water won't come back to the throat. It passes from the same nostril or it might come from the other nostril. So it prevents water entry coming to the throat by making sound ka ka ka. After a few days of practice or few months of practice, even without making sound, we can just make a movement of the palate saying ka ka. So that also it won't allow the water to come to the throat. That happens over a period of time with the practice. Once the irrigation is done, so what are the tips you have to follow? You can expect little bit of irrigated saline or the fluid to come back from the nostril while working. So no need to panic. It's quite natural. So the best way is just do this irrigation in your washroom before taking bath. So it takes 10-15 minutes for the bath. So by that time there will be movement of the body and the irrigated fluid will drop back without affecting your formal dress or any kind of dress where you wear to the office. Second thing, in the evening time, as soon as you come back from the office, you can do the irrigation. So you can maintain at least 2 to 3 hours of gap before going to the bed. So it won't affect your sleep after the nasal wash. It's a very simple but very effective technique with the budesonide and with the normal saline.
Is there any other technique for nasal irrigation?
Yeah, definitely. So we had learned how to use the budesonide residues for the nasal wash. So now we can use this sachet which contains sodium chloride and sodium bicarbonate, nothing but a salt, to do the nasal irrigation. So open the sachet, empty this sachet completely into the bottle. Once you empty the sachet, fill the bottle with the normal saline, or you can use the fresh filter water, or you can use the boiled and cooled water of 200 ml. Mix well. Place the nozzle into the left nostril or to the right nostril. To begin with left nostril, you can just direct the tip towards the left side of the nose. Press this very gently till you won't feel any pressure in the ear. Few of the patients, they might feel pressure while using this nasal wash. That is common. The solution not to feel much pressure in the ear is don't apply much pressure in the bottle. So give half of the pressure what you are using before you used to get that pressure in the ear. So empty 100 ml on the left side, empty 100 ml on the right side. So this you can do twice a day to irrigate the nose. Now, what are the important things we need to know while doing the nasal wash. First and foremost, don't place this tip direction towards the midline of the nose. That will damage your septum and it might lead to bleeding also in rare instances. Similarly, while doing on the right nostril, don't direct this towards your nasal septum. If you find any difficulty while inserting this tip into the nostril, so you have to get it evaluated with the ENT specialist. Without ENT specialist guidance, don't do this nasal wash because you might be having obstructions in the anterior nasal cavity like turbinate hypertrophy, or you might have a deviated septum, or the polyp might have completely occupied the anterior part of the nasal cavity. So always better get evaluated by the ENT specialist before doing this nasal wash or the nasal irrigation. Second thing is, after doing the nasal wash, wait for 10 to 20 seconds and you can do the movement of your head towards the left lateral, right lateral, and flex your neck and extend your neck. So any collected fluid or the irrigation secretion that will fall to the wash basin or the sink where you are doing the nasal wash. That will prevent soiling of your dress. These are the two important points where you can follow to have a very effective nasal wash.